Acute lymphoblastic leukemia, or ALL, is a type of blood cancer. ALL cells are very rapidly growing and it needs to be treated fast. Normally, blood is produced in the center of your bone in a place called the bone marrow. These bone marrow produces normal, healthy blood cells. However, when ALL occurs, the normal, healthy cells are replaced by these abnormal cancer cells. These cancer cells travel in different areas of your body and replace your healthy cells, which can cause symptoms. So what are the symptoms of ALL? Normally, the symptoms of ALL would include getting fatigued or tired or weak easily, bleeding or bruising from abnormal sites, recurrent infections, falling ill, having fevers, and pain in your bones. You might or might not have one or more of these. How is ALL diagnosed? For ALL to be diagnosed, your doctor will first see you, perform a physical examination, and then do some tests. These will include blood tests, of which complete blood count is essential. Bone marrow examination is an essential part of the diagnosis of any leukemia. In this, a small portion of your bone marrow is extracted and examined under the microscope, and certain other tests are run in machines. This is very essential for your diagnosis. So how is ALL treated? The treatment of ALL is performed in three main phases. The first phase is known as Induction of Remission. In this, doctors will administer chemotherapy. Now, chemotherapy is the name given to medicines that either kill or halt the progression of your cancer cells. You might also receive other types of therapies depending upon what type of leukemia or ALL you have. These might include immune therapy, which would essentially mean potentiating your immune cells to kill cancer cells, or targeted therapies to attack cancer cells having certain characteristics. The first phase of therapy usually lasts for about 4 weeks, during which you need to be admitted or stay very close to the hospital. You might have certain side effects and need to be monitored very frequently. Most patients usually go into remission after the first phase of treatment. By remission, we would mean that the doctor would not find cancer cells when they examine your blood or your bone marrow. But that does not necessarily mean that your cancer cells have entirely gone away. So to prevent them from coming back, you need more therapy. The subsequent phase of therapy is known as consolidation and delayed intensification. It lasts for a couple of months, during which you get more chemotherapy. But usually the side effects of therapy in these phases of treatment are lesser than your induction phase, and so you might not need to be hospitalized for long. However, you need to be very close to the hospital so that if you have symptoms at any time of the day, any day of the week, you need to come in and get yourself checked. After the intensive phase of treatments are completed, you need to be on maintenance therapy. This lasts for about 2 to 3 years, wherein you get oral therapy. You also need to come in very frequently for follow-up checks to your hospital. It's roughly about once in a month, wherein the doctor will see you, talk with you, perform blood tests to check if your disease is under control. This also helps titrate the dosages of your chemotherapy. What happens after the treatment is completed? After the treatment is completed, you need to come in and get yourself checked by your doctor very frequently. Not maybe as frequently as previously, but maybe once in a month or 3 months. The doctor will check you, do certain blood tests to ensure that the disease has not come back. You might need a bone marrow test once in a while if your doctor thinks so. What happens if the disease comes back? If your ALL comes back, in which case it would be known as a relapse, you would get more chemotherapies, immune therapies, or a bone marrow transplant, which is often also known as a stem cell transplant. But remember, even a relapse in ALL is curable. Do not get intimidated by the disease. Together we can and we will conquer cancer. Remember, ALL is curable. Stay safe, stay well. Thank you.